And Dr. Deepak now joins us on the program for more on this. Dr. Deepak, like you and I, many of us are now concerned as to what's happening in the National Capital Region. Year after year, this problem remains a situation where both the Delhi government and the Punjab government keep on playing with our lives at the moment. You have to shut down schools every year. Are we not learning any lessons? AQI levels are at 404 in many regions where we've breached the severe mark. What more needs to be done to tell the authorities to do their job much before the onset of this entire environmental crisis?
The environmental crisis is definitely on. And now time is not about prevention. Time is now about management. I understand that now the Delhi government is trying to restrict the complications in the children and trying to give them the school off till 5th grade and all. But that is not going to help much because pollution is right now everywhere in Delhi. Forget Delhi, there in other cities as well. So time is for innovation. Time is to take care of the pollution coming from our vehicles. Time is there to restrict, have a very big restriction on burning the crop, what you call it, parali or whatever, and the very strict rules to be there for old vehicles running. Odd and even, I don't think will help a lot because in Delhi, average one family is having one of more than 2 cars. If you see that. So odd and even is not going to help much. It will be just like you are just showing that you are doing something. But very important is to scrap all the old vehicles, do something to now curb the pollution. We are now away from the prevention part. Now there has to be something to take care of the existing pollution. What is happening in the capital of our country and. Which is going to be there in other cities as well. We are talking only about Delhi right now, but other cities are not very far behind. So definitely the rule on burning the crops, rule on the combustion, rule on the vehicles, very strict norm on the quality of the fuel which is used in the vehicles, the industrial pollution in terms of the combustion. Again, I'm saying, and to be done something innovatively. Involve the technology. Involve something which can minimize the complication of the pollution. We are talking about AQI of 500 plus. Now the winters are coming ahead. Now the air will be cooler and the pollution is going to sediment down. And forget about the breathing issues and the respiratory and heart issues. Now we are talking about much more than that. The heavy metal poisoning and the psychological.
Are you also seeing an increasing number of cases, especially? People who've had those existing issues, say like a bronchitis or an asthma. Are you seeing an increasing number of cases now?
Yes. Absolutely. I tell you one thing, the COVID came and somehow it was a big pandemic and somehow we were attributing most of the respiratory and the cardiac illness to COVID. But here I have no hesitation saying that this pollution is the bigger villain, I can say that, bigger villain and a bigger culprit than COVID. So the causes what we are in the right in some cases like bronchitis, bronchial asthma, and forget about them. I'm talking about the coronary artery disease even in the young age group, diabetes and psychiatric issues, psychological issues, migraine, menstrual disturbances in women. These are all attributed very majorly should be attributed to even the pollution level what we are breathing. This is something. Now this is a bigger pandemic. I will not say epidemic. Even pollution is a big pandemic now. It is in fact. We are in the pandemic state of pollution, air pollution.
Right, and Dr. Deepak, at this moment, there are many international agencies which track climate health also point out to the fact that the quality of air is so bad that India perhaps leads on the charts when it comes to premature deaths because of air pollution. The reduction in age, of course, that being one of the factors, it never really was looked into very carefully. If it did, we wouldn't have been in the situation time and again. And it is a man-made disaster. Let's not forget that. But at this point, I'd like to draw your attention to all those viewers watching right now and who are dealing with this particular hazardous atmosphere right outside their doorstep. What is your advice to them, especially for children? Shutting down schools and putting them inside one room is certainly not going to help in the long term. So, for the moment at least, what are we expecting parents and other people who are prone to such, deadly air diseases linked to this polluted air? What is your advice to them? What should they be doing right now as an interim relief?
As a doctor, I can just advise one thing which many people may not like. So what we have done during the COVID phase, we were using the N95 masks. And Delhi had actually introduced such type of mask even before the COVID for the pollution. Whether we like it, we hate it. But right now, to prevent ourselves from this disaster or this demon of the air pollution in Delhi, the one thing what the children and even the adults and the elderly can do is to use the mask, to use the N95 or the pollution mask. They should use it, undoubtedly. There is no other thing what they can do right now other than this.
Right, an
Consider it
N95 mask.
like,
All right.
like COVID. Consider it like COVID, madam. Consider it like COVID.
All right, that's alarming. Thank you, Dr. Deepak, for joining us.